Oro-facial pain related to maxillofacial surgery. The oro-facial pain is unpleasant sensation caused by noxious stimulus that is mediated only along a specific nerve pathway into the central nervous system where it is interpreted as pain. الإيفالويشن of orofacial pain يشمل عندنا medical و dental history و chief complaint and pain history. chief complaint include pain quality. pain quality for example aching, throbbing, burning. duration of each episode of pain. وعندنا affected side by ask the patient to point to the source of pain and outline the area affected by it. initiating factor اللي هي anything that patient remember occurring immediately before or at the same time as the start of their symptoms. exacerbating factor anything which make the patient symptoms worse. relieving factor اللي هي anything which relieve either partially or totally the patient symptoms. For example nerve block anesthesia والanticonvulsant drug. associated sign and symptoms تشمل lacrimation, vomiting, nausea, fever and anything. previous investigation و previous treatment. physical examination تشمل vital signs, intraoral examination with oral cancer screen. الصورة اللي على اليسار توضح oral cancer screening والعلى اليمين توضح intra and extra oral examination. عندنا head and neck examination هم تشمل lymph node والTMJ والskin والmyofacial examination. هاي الصورة توضح TMJ examination. عندنا cranial nerve examination تشمل evaluate the trigger zone, area of hyperesthesia and area of hypoesthesia or anesthesia. diagnostic anesthetic testing هنا راح نستخدم local anesthesia free of vasoconstrictor. ونلاحظ إذا البين توقف إذن هذا البين يكون سببه peripheral cause، يعني هو due to peripheral cause. عندنا هسه imaging and special investigation تشمل عدة أنواع اللي هي cranial nerve screening examination، laboratory blood analysis اللي هي أهمها ESR MRI bone scan. cause of orofacial pain عندنا أما local cause اللي هي مثل disease of teeth، disease of periodontium، disease of oral mucosa، disease of jaw و disease of salivary gland. أو تكون psychogenic cause مثل atypical odontalgia و atypical facial pain، burning mouth. أو يكون vascular cause مثل الميجرين والبريودك ميجرينس نيورالجيا والجوينت سيل ارترايتس والريفيرد بين. راح نقسم البين حسب الاوريجين مالته الى somatic pain اللي هو originate from the cell، والneurogenic pain discomfort resulting within the nervous system. psychogenic pain result from psychic cause، no noxious stimulus، no abnormality in the neural structure. أول نوع اللي هو النيوروجينيك، أما راح يكون neuritis اللي هي inflammatory change of the nerve، أو يكون neuralgia اللي هو pain along the course of the nerve causes أو caused by vascular spasm and CNS disease. أو يكون vascular it is usually poorly localized chronic preceded by minor electric shock like pain. neurogenic pain أول نوع عندنا التراجيمينال neuralgia. it is a self-limiting disorder characterized by instantaneous attack of sharp lancinating shooting pain confined to the area of distribution of trigeminal nerve and characterized by the presence of trigger zone. يعني هي تكون فقط بمنطقة البرانشز مال trigeminal nerve اللي هي الأوفثالميك والماكسيلاري والمانديبيولار. الاتيولوجي مالتها أما demyelination اللي هو demyelination بالنيرف أو يكون vascular compression of trigeminal nerve مثل ما موضح بالصورة. عندنا superior cerebellar artery مسوي لي compression على الترايجيمينال نيرف فسبب لي trigeminal neuralgia. أو السبب الآخر اللي هو trauma or infection of the nerve أو يكون idiopathic يعني بدون سبب. الانسيدنس it is involving area supplied by the second third division of trigeminal nerve يشمل التيث والجو والفيس and associated structure. يعني الثاني والثالث اللي هو الماكسيلاري والمانديبيولار. الage more than 40 years of age in affected patient under 40 years suspect serious underlying pathology, for example tumor or multiple sclerosis. السكس اللي هو الفيميل تتأثر يعني affected more than male بنسبة 2 إلى 1 والرايت side affected more commonly than left side ويكون mostly unilateral. bilateral is relatively uncommon يعني هو أكثر شيء يصير unilaterally. ال second division of trigeminal nerve اللي هو الماكسيلاري is more commonly than the third division اللي هو المانديبيولار division. On the other hand the ophthalmic nerve is involved only in 5% of cases. الفيتشر مالته البين is limited to one of 3 division of the trigeminal nerve. Most commonly the second and third division crosses the midline described as sharp and stabbing electric shock. It is a rapid onset or short duration with rapid recovery. Paroxysm occur most commonly in the first hours after awakening. Patient having period of daily pain, then a period of remission. The remission may last days, weeks, months or years. يعني الألم راح يتوقف ومرات هذا التوقف يستمر أيام أو أسابيع أو أشهر أو حتى سنين. Trigeminal neuralgia doesn't affect sleep. The pain evoked by touch or breeze to the trigger zone on the face or mouth or evoked spontaneously. هسه التريتمنت عندنا أما يكون medical treatment نعطي كاربامازيبين usually begin with 200 ملغرام 2 times daily و second line of drug. إذا البيشنت ما تحمل السايد إفكت مال الكاربامازيبين أو هو الكاربامازيبين ineffective after 4 weeks then the patient started the second line drug اللي هي anti-epileptic medicine and tricyclic antidepressants. أو عندنا peripheral procedure اللي هي interruption of any part of trigeminal pathway أو أسوي local anesthetic block for emergency أو peripheral nerve destruction by cryotherapy alcohol injection or nerve avulsion. أو عندنا نستخدم الجانجليون procedure تشمل الراديو فريكوانسي thermocoagulation, الglycerol injection, بالون compression, radiosurgery, gamma knife اللي هي هاي الصورة توضح انه اشعة جاما راح تتركز على الجانجليون. او عندنا surgical treatment تشمل trigeminal root section. It is an intracranial surgery in which the sensory roots of Gaussian ganglion are cut, sparing the motor roots. وعندنا المايكروفاسكولار decompression تشمل يا أما a loop of an artery اللي هو أكثر شيء superior cerebellar artery which is resting on the trigeminal zone causing the nerve to produce the symptoms. In this operation the loop of the artery is dissected, elevated, and then small prostheses are put to separate the artery from the nerve. هذا الفيديو راح يوضح البروسيجر مال الديكومبريشن.
This video illustrates the steps during a microvascular decompression for trigeminal neuralgia. The trigeminal nerve is seen on the right, and the superior cerebellar artery is seen indenting the superior surface of the trigeminal nerve and contacting it with each pulsation. The first steps of the procedure under the operating microscope are to free the arachnoid adhesions between the superior cerebellar artery and the trigeminal nerve, and you can see the indentation in the superior surface of the nerve when the artery is mobilized and freed from its adhesions. The next step is to place a Teflon pledget between the artery and the nerve to keep the artery from contacting the nerve and irritating it with cardiac pulsations. The first pledget is placed and the artery is mobilized superiorly, and then a second pledget is then placed to ensure that there's no contact between the artery and the nerve.
Good morning everyone, I am Saja Yosef in 5th class, College of Dentistry, University of Baghdad. I will continue now our seminar about the oro-facial pain related to the maxillofacial surgery. I will talk now about the pretrigeminal neuralgia. It is an dental pain in the region where the physical and radiographical examination reveals no abnormality. Local anesthetic block on the tooth arrested pain. Pretrigeminal neuralgia responds to the similar treatment as trigeminal neuralgia, beginning with the anticonvulsant therapy. Vagoglossal pharyngeal neuralgia. It is sharp, paroxysmal, electric shock pain radiate from the oropharynx or the base of the tongue to the tonsils, larynx, soft palate, ear, the mandible ramus, or even the region of the TMJ. What is the feature of the vagoglosopharyngeal neuralgia? The pain is unilateral and short duration. Swallowing, chewing, speaking, eating, and drinking can be trigger attack. Pain is stopped by anesthetizing the pharynx with the topical anesthetic where trigger point is located. The incidence, middle age and old age are mainly affected. The female more affected than male, left side affected more than right side. Herpes zoster or shingles, the only non-dental pain that is may truly mimic palpal pain. Herpes zoster causes chicken pox in children, but like herpes simplex, reactivation in adults give rise to the shingles. The disease is commonly but mainly limited to the adults, often over 60-year-old. In the trigeminal region, the ophthalmic region, as we can see in this picture, this trigeminal region, and the ophthalmic region is the most commonly affected in the herpes zoster or shingles, as we can say it in Arabic الحزام الناري. The symptoms: severe unilateral deep-seated burning pain in the prodromal phase few days before the rash and physical develop. Physical become weeping and crusting on the skin but remain as shallow ulcer in the mouth. The physicals and ulcer are unilateral in distribution. The sign, as we can see in these pictures, if the maxillary division is involved, as we can see in the right picture, the hard and soft palate are affected unilateral. If the mandibular division, extensive unilateral cutaneous lesion will be present also. And also the ophthalmic division can be affected, as we can say it before. This is the serious coronal ulceration may be developed, and also the headache. Aura include reversible sensor motor, visual, and speech disturbance. The visual, we mean the zigzag, light or blurred vision, as we said. The sensory, such as numbness, paresthesia, and anesthesia of the face. And motor, also like the unilateral muscle weakness in the face. Migraine without oral headache, unilateral throbbing, moderate to severe, accompanied by photophobia and nausea and vomiting, aggravated by physical excretion. The treatment: samtriptan, non-steroidal anti-inflammatory drug, and opioid analgesic antiemetics. Giant cell temporal cranial arteritis. Pain is caused by ischemia resulting from arteritis. Also, as we said before, female is more affected than male. The symptoms: severe unilateral to the temporal and frontal area, side of the head and behind the eye. Pain can be brought on by eating due to ischemia of the masticatory muscle. The temporal and frontal skin and scalp may be tender to the touch. This is one of the few pain disorders with the systemic upset. Ocular symptoms include loss of vision or in one part of the visual field. The signs: temporal arteritis may be occluded, pulseless, thickened, and tortuous. The treatment: if the retinal arteries are involved, rapid deterioration in the vision occur. Acute necrosis of the facial tissue may be occur, such as gangrene of the scalp, lip, and the tongue, using high-dose corticosteroid. Psychogenic pain, atypical facial pain. This pain, described by the Vega, contains dull present all day, every day. It has been associated with the depression, anxiety, stress. Is the most common in female over the 50-year-old. It may be unilateral, bilateral, and cross midline. No causative factor detectable. Cranial nerves are intact. What is the treatment? The treatment: psychotherapy, anxiolytic, antidepressants. The anti-pathological and symptomatology are the same of those atypical facial pain, but the patient attributed the pain with the teeth. Many dental treatments have been attempted by different dentists, including serious extraction or with no improvement in the pain. The incidence 6 male more common in female, age usually over the 50 years, nature burning tongue, loss of the taste, and abnormal metallic taste. The site is the tongue, lip, and hard palate and alveolar ridge. The symptoms severe continuous burning pain, often bilateral and present for the month, 2 or years. Pain is often relieved by eating. The tongue is involved most often, but any mucous membrane may be affected. Sleep is not affected. The sign no mucous membrane abnormalities can be seen in area of affected abnormalities. Diagnostic tests. What's the test we needed? The test we need, such as hematology ESR, thyroid hormone or thyroid function as T4, T3, TSH, examining denture, salivary flow tests, swab, smear, oral rinse to the test for the candidal infection. The treatment: when the other factors have been excluded, the patient should be referred for the psychiatric assessment. Antidepressants and cognitive behavior therapy may be helpful. Somatic pain. The maxillary anterior and the nasopharynx. The sinusitis infection, usually bacteria of the maxillary sinus. The symptoms usually unilateral, rare, bilateral, dull throbbing, continuous pain limited to the upper jaw and under the eye. The pain is worse in the evening and with the bending and shaking of the head. Patients may be feeling of fluid moving in the affected sinus. Stuffy nose, nasal discharge, and fullness of the cheek may be described as cold in the head. Pressure over the cheek causes pain. Crepation in the joint sound. A pre-auricular pain but not involving masticatory muscle. What we will see in the radiograph will show the degenerative joint disease as rheumatoid arthritis, condyle fracture of the traumatic arthritis. In the ear, otitis media, pain in the region of the temporomandibular joint. This pain may be involve the facial nerve leading to unilateral facial paralysis, as we can see in the right picture. Eye, as we know, the glaucoma due to rapid increase intraocular pressure. The symptoms of the glaucoma is severe unilateral orbital pain, centered above the eye, but may radiate across one side of the face. And finally, the sign of the glaucoma: the eye is stony hard due to rising intraocular pressure. The pupil is dull, oval, and dilated. The cornea is misty. And thank you for your listening.